Hi, in this video we're going to be talking to you about high definition liposuction. What is this high definition liposuction all about? Now before going into this, we must be aware that liposuction is an old technique where it has evolved over the last 20 years. Now the first liposuction technique which came into vogue removed all the fat, excess fat from the abdomen or the thighs or the back, wherever it is. So it just concentrated on removing extra fat. Now an advance to this was the ultrasonic liposuction, where the fat was targeted more precisely and you could get a lot of skin retraction because of heating. Now we are in a time when liposuction is at its best. We call this the high definition liposuction. Now what is high definition liposuction? Any person who has a normal BMI, who has exercised enough, who has dieted enough, but still wants to achieve a lot of contouring, is not able to do it. And this is where they come to us plastic surgeons for achieving their goals of a sculpted body. Before getting into a high definition liposuction, we need to understand what are the features of the body which actually help us plastic surgeons in achieving what we want and the patients what they want, the sculpted look. So this is a male mannequin. Now if you look at this, it's a well sculpted body. There's a good pectoral definition. And if you see the packs which most people crave for are the six packs which start off from just below the chest. That's the first pack, set of pack, the second pack of muscles, and the third pack of abdominal muscles. And then there's a gradual convexity over here. And you look at the line over here, that's the midline raphe. And then you see the semiluminous line which ends in the lower part of the abdomen. And also look at the groin lines which are there in Michelangelo's David, which is very popular. You can see these lines. All this is possible to sculpt, to create with the high definition liposuction. And this is what our patients want. Now, this is a male patient which I'm talking about. Now, there can also be a woman who wants a chiseled look. So for a woman, we don't give the six packs, but we give the midline raphe and we give the semiluminous lines, and of course we give a very good waist definition, which is what they want. And all this is achieved after doing a good back liposuction, and then we start doing the contouring of the body. So this is what we do. So a good pectoralis cuts. So we remove all the fat which is in the lower part of the chest, thereby giving a nice pectoral line. And you can see this, the groove between both chest muscles, which defines the chest muscles. And of course, the lower abdomen, we start sculpting it by removing a lot of fat. Now, what is the technique we do? First of all, we give some fluid where we make it easy for our liposuction so that there is no blood loss. Once we give the fluid, we have what is called as a radiofrequency energy. Now this radiofrequency energy, we deliver it just below the skin so that the skin becomes nice and tight, and it grips the underlying fascia and thereby helps us achieving these grooves. So it helps in good skin retraction. So you're seeing all this, these lines. We give a lot of energy over here for the skin to get nicely contracted and the sculpted look. HD liposuction, it takes more time than the standard conventional liposuction because it is very precise, and you have to achieve all the sculpted the look. What we do it on the right, it has to be mimicked on the left side, and obviously this is going to take time. But at the end of the surgery, the patient is extremely happy with the sculpted look. There are a lot of maintenance things that you need to do in the post-operative period, like you'll have to wear a special vest, you'll have to wear foams which help in maintaining those grooves, and of course the massages which are obviously needed in the post-operative period to prevent any collections of fluid, or even to get rid of the unwanted water inside which is accumulating. So this is what happens in a high definition liposuction. for the exact result to happen, it takes almost up to 4 to 6 weeks for it to happen. But most of our patients are extremely delighted with a sculpted look. A commonly asked question is, how is HD liposuction different from a conventional liposuction? So a conventional liposuction, we first instill fluid and then suck out all the unwanted fat. That's it. So it's just a mechanical removal of fat. And it is done in a very, very gross manner, that if there is some amount of fat in the abdomen, all the fat is uniformly sucked out. Now, what happens in a HD liposuction is, you'll have to get the features, the good features. The good features are what? The six packs, the lines, the midline raphe, the inguinal depressions. So all this is adding to a sculpted look. So we target only these in a high definition liposuction to get the best features out in the body. Of course, for a patient to get a high definition liposuction, he has to be in his ideal body weight. He or she has to be in an ideal body weight, number one. The BMI has to be really good. Meaning, these patients would have to have a good lifestyle, they have to be eating healthily, they have to be having a good exercise schedule. These people are wanting all these features, they try for it but they don't get, that's why they come to us. Once we do the HD liposuction, it takes almost around 4 to 6 weeks for the patient to notice some form of the grooves which you have actually designed. But it will be good to say that a patient may notice all the features after 3 months. The results of HD liposuction are permanent. A good healthy lifestyle, a good balanced diet, good exercise activity will help in maintaining the result of 3D liposuction. Just like the conventional liposuction, the side effects can be very, very minimal in a HD liposuction. Now, what are the common side effects which we see in HD liposuction? You will see a lot of bruising. That's because of repeated amount of work or suction which is being done in the abdomen. There could be swelling, and one of the significant side effect which we see is accumulation of fluids or seromas, especially when we do radiofrequency assisted HD liposuction. So to avoid these, we put drains in the lower abdominal area, at least for 3 to 5 days, and then we remove the drains so that there is no fluid formation accumulating in the chiseled areas. So to conclude, HD liposuction is very much doable. It's absolutely safe. Now, because our patients are actually in their ideal body weight, they have a very low BMI, the risk factors are very, very low. So all you have to do is get prepared and wait for your sculpted body. Give it around 3 to 5 hours of time in the operation theater along with us, and you have a fabulous sculpted body.